Thanks for joining us on this Monday night. At the top of our show, we're going to talk about hurricanes and the impacts they will have here at home. Right now, there's a mad dash to get the heck out of Florida as another monster storm, Hurricane Milton, is picking up steam in the Gulf of Mexico. And this just comes days after Hurricane Helene hit the southern U.S. as a Category 4, one of the most powerful ever to hit our country. Helene's wrath ran all the way up Florida, through Georgia, into the Smoky Mountains and destroyed everything in its path. Hundreds of thousands of people across the Carolinas still don't have power because of Helene. And hospitals across our state and the country are scrambling to adapt to a major ripple effect from that storm. Some have started rescheduling non-emergency surgeries because they need to conserve IV fluids after the largest supplier in our country was knocked offline during this storm. Kent can explain. Hi, Kent.
Hi, Jenna. Yeah, a facility in this small town of North Cove, North Carolina, produces roughly 60% of all the IV fluids used by U.S. hospitals. Normally, it's about an hour drive from there to Asheville, but following the hurricane, the roads in and out of there were damaged, and so was the facility itself. Now, Baxter International, which produces those fluids, says we are working with the greatest urgency, but we do not yet have a timeline for when operations will be back up and running. And that means hospitals here and everywhere are scrambling to save these critical fluids where they can. Less than a week after learning that Hurricane Helene took Baxter International's IV products out of circulation indefinitely, both mHealth Fairview and Hennepin Healthcare have joined a growing list of providers contacting patients to reschedule or cancel non-emergency surgeries. mHealth adding in a statement, rescheduling and delaying surgeries are decisions we do not take lightly, and we understand the impact it has on our patients.
It's going to be a lot of work and a little bit of pain for us to be able to get through this.
Mike Walt is director of pharmacy for North Memorial Health, which has not had to cancel any procedures, at least so far.
We had supply on hand, which gave us a little bit of insulation, but that insulation is not going to last very long.
He says they are taking several other steps to conserve the fluids, which are used for everything from battling dehydration to mixing critical drugs.
Take antibiotics, for example. We've moved some of those to an IV push rather than an IV infusion. So instead of using that bag, we're just going to add that into a syringe that can be administered slowly.
If you're doing a push instead of in an IV bag, is that more labor intensive then?
Absolutely. Instead of a nurse being able to set up the infusion pump, now they're going to need to stand there for a certain amount of time.
They do hope to save some time and fluids by eliminating IVs in some outpatient settings.
We're trying to get patients to hydrate before they're coming in for some of those elective procedures so that we can continue to do those procedures and conserve those fluids.
In the meantime, they're hoping a letter the American Hospital Association sent to President Biden this morning will help. It asks him to direct the FDA to declare a shortage, direct Health and Human Services to declare a public health emergency, and to invoke the Defense Production Act,
so that other manufacturing plants can come online, that Baxter hopefully can ramp its production back up, and that we can have the IV fluid supplies for our hospitals be restored.
The Minnesota Hospital Association also held a call with about 300 state healthcare leaders today to share information and tips for conserving a critical and now limited resource.
Our main message to our patients is please be patient with your care teams at the hospitals, and also do stay in touch with your providers so that they can oversee your care plan with you and make the right decisions based upon your care condition.
Now, other companies say they are already working to increase production to help with this shortage, but one of them, B. Braun, which accounts for about a quarter of the U.S. supply, has a facility in Daytona Beach, Florida, which could be in the path of Hurricane Milton. As of now, though, they say they're monitoring the storm and taking steps to protect their employees and those critical IV supplies. Currently, that is another mess. We just got to hope that they avoid it.
Yeah, this Hurricane Milton has already started to change so many trajectories of our life in the entire country. We first heard, at least I first heard of the Defense Production Act during COVID, when we were talking about ventilators and things like that. Is it something that gets things going quickly?
Yeah, that's the hope. They can kind of clear the ways for some of these different facilities to ramp up production. There's also a suggestion that they could maybe go to some international providers and bring them in, kind of clear the way faster so that they can get whatever they can up and running.
All right, well, it feels like this is a story we'll stay on top of. Thanks so much, Kent.